I'd like to welcome you to Courage to Change Recovery Partners Clinic here in Macedonia, Ohio. My name is Brian. I'm the clinical director here and a grateful recovering addict with about 4.5 years of sobriety from opiate addiction. Today we're talking about addiction as a brain disease. And it's a brain disease that develops over time as a result of initially the voluntary use of drugs that over time becomes involuntary and compulsive. That first Vicodin that you took during high school maybe was voluntary, and perhaps for the first 6 months or a year you just partied on weekends or whenever you can get it. But at some point in time there becomes a change in the brain, and then it becomes involuntary. And that's what the crux of what we're going to talk about today. It's as if the brain's motivational circuits become hijacked, with the result that the drug seeking becomes the main motivation for the individual. And I guess the big question is, why does this happen? All primates and higher animals and mammals survive on the basis of a reward system in the brain. When we do something that aids our survival, such as sex or eating, the brain releases a neurotransmitter called dopamine. And this is a feel-good chemical, and since this makes us feel good, we repeat the behavior. Opiates are particularly good at causing the brain to release this chemical, and it results in a massive release of dopamine which floods the brain, and essentially causes a sense of well-being and euphoria and energy, and can be quite overwhelming for an individual the first time they're exposed to it. Now the brain tries to deal with this flood of dopamine over time by perceiving it as being abnormal, and so it tries to essentially think of it as mop up or suck up the extra opiates that are flooding the system. So it makes more opiate receptors to bind the opiates and suck them up. And as a result of this, the addict requires more and more opiates over time to get the same effect, and this results in tolerance, which is any addict can attest to, that what he used to find adequate is no longer adequate in terms of getting him high. This transition, this effect in the brain, can take as little as a month, and so many addicts will look back at that first month as being the best month of their life, but rapidly the brain adapts to the situation, and it requires increasing amounts to achieve the same effect, and this results in the addict over the course of their drug career chasing that first high. Over time the brain dopamine levels will actually decline, and this causes further withdrawal symptoms and causes the addict to try increasing amounts of opiates to achieve the desired effect. In very short order, the substance user has become a substance abuser. And many family members and society at large mistakenly feel drug addiction is a failure of will or a character defect. The research contradicts that. It doesn't mean the addict isn't responsible for their recovery, and doesn't absolve them from personal responsibility for their behavior. However, it does explain why willpower alone is not enough. Once you cross that threshold from voluntary to involuntary, you can't go back. You must forever abstain from opiates. And this correlates with step 1 in a 12-step program, that powerlessness that they talk about in the unmanageability in the life. This is key in terms of staying clean long term. The people who think they can dabble in opiates after recovery or just use them recreationally like they did at first are doomed to failure and relapse. There's a genetic basis to addiction. Probably 50 to 70% of that susceptibility, that transition from voluntary to involuntary, is genetically mediated. But there's a lot of other factors, environmental, societal, cultural, that also factor into it, which makes it a very complicated issue and beyond the realm of this topic today. In NA and AA, we often say you must get rid of your playmates, playthings, and playgrounds. And the reason for that is that cue-induced cravings cause many an addict to relapse. So if you drive by the dope house every day to work, that's going to be a trigger for you. If you hang around with individuals who are still using drugs, particularly in front of you, well, sooner or later you're going to relapse. And a big part of the recovery in a 12-step program is learning how to deal with those cue-induced cravings. So for instance, if you have this desire to use and it's overwhelming, rather than succumb to it, you can go to a meeting and lose that desire to use. Or you can call your sponsor and talk about it on the phone. I guarantee you the desire to use will be gone. Those are the types of skills and coping mechanisms that anyone who's successful in treatment is going to have to adapt to and be willing to pursue. Very few addicts for this reason can quit on their own and require biomedical treatment, including medical and psychological. This is why the importance of medically assisted treatment like Suboxone in conjunction with cognitive behavioral therapy or a 12-step program is key in enhancing the success rate for treatment of opiate addiction. Your brain is profoundly changed and to a certain extent damaged, and much of those changes are irreversible. Although with time the depression, the isolation, the anhedonia, that means loss of enjoying things that you used to enjoy, the fatigue, the procrastination, all those things will resolve, but it may take 6 months to a year, so you have to be patient with that. But you have to remember your brain wants you to use. It'll use every technique it can think of to try and get you to pick up again. It's ready and waiting to pick up where you left off. You can be 20 years clean, and if you were using 20 Percocets a day 20 years ago, 20 years from now, in order to feel normal on opiates, you'll have to do at least 20 Percocets. That's the amazing thing about opiate addiction. And as any addict can attest to, each relapse is worse. Every time you pick up again, the consequences come faster, the tolerance goes higher, or the spiral and speeds up quicker into depravity and degradation, and it never ends well. You just have to understand that you can never use mood-altering drugs again successfully. And there's a topic called cross-addiction, which means any mood-altering drug will make you crave your drug of choice. So you can't go out to the bar anymore. You can't take a Valium or a Xanax when you're anxious. You can't dabble in ecstasy or crack or cocaine or methamphetamine because it will make you crave your drug of choice. However, the good news is you can get your life back. If you're willing to take a little direction and get involved in a program of recovery and use the Suboxone as a tool to help you recover, not a cure, then I feel optimistic that we can get your life back. And I hope you'll consider us in your journey to accomplish that. I want to thank you and take care.